a dental professional, you know that brushing is not enough. If you just brush, food debris and bacteria get left behind that can lead to gum disease and tooth decay. Your patients have to floss. So let's review what we know from your patients about flossing. They don't like it, they don't do it correctly, and they tend to lie about it. In fact, a recent American Academy of Periodontology survey shows that over a quarter of your patients admit to lying about how often they floss.
Let's be honest, in my practice and in most practices, the percentage of patients that floss correctly and regularly is very small. I'd have to guess it's less than 25% in my practice. That's a terrible, terrible statistic.
They'll have stacks and stacks of free floss that I've given them for years, and they're not using it, but they will use the water flosser.
Waterpik water flossing is the modern way to floss. When I'm done, my teeth feel squeaky clean.
Water flossing is the easy and more effective alternative that can help your patients end the lie. Just how effective is the Waterpik water flosser? Let's take a look at the research. In a study at the University of Southern California, the Waterpik water flosser was proven to remove up to 99.9% of plaque biofilm from treated areas.
You apply the Waterpik to plaque on the surface of a tooth, and you look with a scanning scope, and it's gone. It's simply gone. And that's unequivocal and unarguable.
In other studies, the water flosser was up to 50% more effective at reducing gingivitis compared to string floss, and was up to 3 times as effective as brushing and flossing, and up to 5 times as effective as brushing alone for orthodontic patients. One recent clinical study conducted at Tufts University proved the Waterpik water flosser is more than twice as effective as string floss for reducing gingival bleeding around implants.
The water flosser is my go-to home care solution for patients with implants. The plaque seeker tip in particular has been shown to be up to 2 times more effective than traditional string flossing. So that's really important. We need to stay on top of peri-implant mucositis. We need to stop it dead in its tracks. I don't take any risks with my implant patients. They get water flossers.
To date, there are over 60 research studies published in peer-reviewed journals demonstrating the efficacy of the Waterpik water flosser.
Dental professionals are men and women of science. We need to respect the literature and how it guides us towards the most effective treatment for our patients. The Waterpik water flosser is time and time again proven to be more effective than the alternatives out there. That's why I recommend it to my patients.
The results are clear. In study after study, the water flosser is unquestionably the easier and more effective way to floss. But what about air floss? In studies published in 2012 and 2015, the Waterpik water flosser was compared head-to-head to Sonicare Air Floss and Air Floss Pro, and each time the water flosser was proven to be significantly more effective. This demonstration on an ear of corn helps to show why water flossing is so effective. Manual brushing only cleans the surface. An oscillating power toothbrush doesn't do much more. Even a sonic toothbrush can't get between the kernels. But the Waterpik water flosser thoroughly removes all the debris within seconds.
Since every single patient of ours gets a Waterpik water flosser, I feel like we are slowly steering them on the right path to better oral hygiene for a lifetime, not just when they're in treatment.
The research has shown that Waterpik water flossing is more effective than traditional string flossing when used in combination with brushing. Significantly more effective. I think a lot of that has to do with the technology behind the water flosser, but I think it also has a lot to do with compliance.
Brushing is not enough. The Waterpik water flosser works, improves compliance, and is clinically proven in study after study. The Waterpik water flosser, the easy and more effective way to floss.